Is recognized for whatever question she cares to pose to the panel.
Thank you so much, Mr. Chairman, and thank you for presenting here today on these two issues. You know, I was going to congratulate our colleague, as we all might know, from Colorado. His new baby, Joshua, came this weekend, and his big sister, Natalie, is important. So I'm sure as he's sitting through these things, he is thinking, and we are all thinking about the children, right? Because what we need to always think about is how are the laws that we are passing and how do we consider the work that we are blessed to be able to do here in DC, how is that impacting our children? And I think that the two bills we are talking about today very much impact our children, our communities, in two different ways. And I think there is a connection between them because we know that fentanyl is being brought into the United States by despicable Americans who are crossing our ports of entry in vehicles, often in trucks. And I think that we need to be very clear that there is, I don't think, anybody here in Congress who isn't dedicated to eradicate the scourge of fentanyl that has impacted our communities. And then I think we get to, but what are we doing, right? And this is where we might have some disagreement because we're very concerned, as you know, that right now as we're struggling to address all of these various issues, you know, the Republican majority is holding our country hostage to force passage of certain funding cuts, and that those funding cuts, if applied evenly, will have a really big negative impact with regards to fentanyl on our ability to treat addiction. And I think that when we look at this bill, Chairman Griffith, I appreciate the fact that you want to address fentanyl. And I don't have a complaint about the fact that we are addressing fentanyl. What I worry about is that we are not addressing fentanyl in the many areas it needs addressing, especially with regards to treatment, especially with regards to the research into what can we do to make sure we better track, better test, so people aren't unwittingly dying from fentanyl when they had no intent of ingesting fentanyl. And we know, we read article after article about that. And I don't think adding those provisions to this bill would make it unwieldy. I think they are very much tied in because, as my colleague, Representative Scanlon noted, you know, we've been doing this for a while. And we realized some time ago that just having an enforcement-only approach does not work, that you need to look at what is it doing in your community. And I guess, Chairman Griffith, I mean, do you agree that treatment of fentanyl, the public health issue, is something that, as a country, we need to address?
In another bill, absolutely. This is not the bill. We have hearings coming up in the Energy and Commerce Committee related to dealing with treatment, et cetera. But we can move this bill forward, hold those hearings, and we can look at another bill another day. And one of the problems that we have in getting something that's comprehensive is we get tied up, you know, fighting over big things, and we don't get anything. And this bill represents an opportunity for us to get something done for the American people.
So is it correct then, though, that your committee has jurisdiction over these matters? I mean, you can address these issues, and they can be addressed in a bill. It could be addressed in this bill.
It could be addressed in a bill, but not this bill.
Yeah. This bill could have handled them if any of the amendments would have been adopted. Ranking Member Pallone, what are some of the amendments that you think would have been very useful in making this bill not unwieldy, but actually focused on the problems that we are facing in my community and in every single community across our country regarding fentanyl?
Well, I haven't looked at all the amendments that are before you, but you know, I mentioned the Pappas Amendment, which is bipartisan, that adds these provisions that the President's task force had recommended, you know, with terms of an off-ramp, in terms of not having mandatory minimums unless it's a serious offense, in terms of, well, there's a bunch of things that I mentioned. I don't have to repeat them. Also, I think Ms. Scanlon talked about the strips to test drugs for fentanyl availability, and that's the Crockett Bill, Amendment number 59, that is before you. Look, we in our committee, as you mentioned, we reauthorize and fund the Support Act, which includes treatment programs, so that could obviously be done. Medicaid, I've been trying to do a Medicaid policy for a number of years that includes a lot of the things that you suggest. I mean, the bottom line is, and I know I just feel like I keep repeating myself, right now, these fentanyl analogs are included under Schedule 1 for the next 18 months, right? We're not really doing anything in this bill other than extending that, which we've done, and making it permanent, which we've done many times, right? There's no reason to believe that this is going to do anything to address not only the treatment, but even increase law enforcement or anything to prevent overdoses. So, I don't want to, I know Mr. Griver keeps saying this is a small step, but I would argue that it's like really not much of a step at all because it doesn't really do anything at all for the next 18 months other than extend the status quo beyond that. The things you're mentioning are ultimately much more important.
Right, and I think that when we have an opportunity to address something, that we should look at it, when those building blocks are in front of us, when they've actually been handed to us, when they say, here is a building block, using that, I think it's a great metaphor for all of us who have children who love to build things, right? That was a great metaphor to use, Chairman, because it is a building block, except for that those building blocks are before us now, and that here in Congress, we don't always have a lot of time. I'm learning time on the floor and time in this committee are some of our most valuable resources. And so when we have amendments which would say, let's encourage education of stakeholders around fentanyl, let's encourage treatment with the substance abuse prevention and treatment block grants that Representative Ballant suggested, Representative Blunt-Rochester's amendments to increase education. These are all things that could be done easily. They're the blocks that we are refusing to pick up and that I think our communities want us to pick up. They want us to do more than just codify the status quo. And I do think that codifying the status quo is important. So I do agree on that, but I do believe that our communities are asking more from us. I wanted to move to the next item, Senate Joint Resolution 11, which in my mind will roll back important progress we've made on environmental issues. Because, when families and kids aren't sick or paying medical bills, right, what they're doing, they're going to school, they're going to work, they're investing in their community, and we know that this bill will have a significant impact on public health. Ranking Member Pallone, can you tell us what some of those impacts are?
Well, I mentioned before, and again, I think you're bringing up a very good point, which is that, and Mr. Johnson talks about the cost to the individual who might, who has a truck, and I think we have tried to accommodate that with this rule. But the purpose of the EPA is to address public health, right? Public health and safety. So it's estimated, I may be repeating myself here, but it says that the final standard, this is what the EPA estimates, that the final standard will prevent each year between 860 and 2,900 fewer premature deaths, 6,700 fewer hospital admissions and emergency department visits, 18,000 fewer cases of childhood asthma, 3.1 million fewer cases of asthma symptoms and allergic symptoms, 78,000 fewer lost days at work, and 1.1 million fewer lost school days for children. Now, again, I hate to talk about these things just in monetary terms, but all these things involve money, right? Because the cost of keeping people in the hospital, the cost of going to the doctor, the cost of swimming, all these things add up. That's where the EPA comes up with this figure of $200 billion saved. So even if you take Mr. Johnson, I think he said that would cost an extra, I don't know what you said, 37 or 57 billion, 39, but can't contrast that with the $800 billion cost of all these terrible things that would happen to people if we
Right.
didn't do this.
And in New Mexico, this is a major issue. We have many children. We have very high rates of cancer. Very high rates of asthma. Chairman Cole, I would seek unanimous consent to enter into the record the January 13, 2023 report about clean truck rules in New Mexico and what they would deliver in terms of $3.3 billion in benefits and avoiding 28,000 illnesses.
Without objection.
Thank you very much. And I think that these are key because our communities want us to keep them healthy, right? And when you have this kind of benefit, it's hard to say no. And with regards to the idea that we are best suited in a hearing that takes, I don't know, we'll spend maybe 30 minutes on this, the CRA objection overrule. 30 minutes is not a lot of time when you are thinking of overruling something that took years and tons of comment, lots of negotiation between the industry and the EPA, looking at small businesses, looking at how do we have protections for small businesses. So to have us in 30 minutes just say, it's all done with, I just do not think that that is the right way to go, that we need to have and look at the expert testimony that has been developed as part of this rule. So with that, Mr. Chair, I yield back.